$3.5 billion allocated to the budget to ensure millions of Australians have better access to free GP visits. The government offered a financial incentive to GPs who don't charge the most vulnerable patients any out-of-pocket costs. This all comes down to bulk billing. Joining me now is the Ambassador for Health Reform at the Australian Patients Association, Dr. Nick Coatsworth. Good to see you. Essentially, this is trying to get more doctors to bulk bill, and it's tripled that incentive for them. Is that enough, and how will that actually work?
Well, Laura, we have to understand what this is and what this isn't. It is a welcome increase in funding, but it's been marketed as 11.6 million Australians getting access to bulk billing. It's not that. It's 11.6 million Australians being eligible for bulk billing. Now, bulk billing is a discretionary matter between a patient and a doctor. So what this doesn't actually do is tell us what the rate of bulk billing will be in July and August when this comes in. We have to wait and see that, but it's almost certain that it'll be less than 11.6 million Australians.
Yeah, doctors are still going to be out of pocket if they increase their bulk billing patients. So can you explain to me what the incentive actually is for doctors to do this?
So I think what it does, look, most GPs want to bulk bill their patients. I think that's fair to say. So it does increase the financial flexibility to do so. But to be honest, the average out-of-pocket payment is $40. They get $40 from Medicare, that's $80, and the bulk billing incentive is $62. So a GP is still going to have to take a little bit of a financial hit, and some of them will, but I just don't see it being 11.6 million Australians that are going to benefit. There's going to be parents who turn up on July 1st expecting to be bulk billed, and they won't be. So it's really important to nuance that message and manage the expectations of patients in Australia.
Yeah, and if you live in an area where there are fewer and fewer bulk bill practices, you'll know that it's pretty hard to get into to see a doctor.
That's right.
At short notice. So from my perspective, this doesn't really solve any of that, because if you can't get in to see a doctor in any timely way, you're still going to go to emergency, aren't you?
You're still going to go to emergency. So it helps the patients who already have a GP.
Yeah.
They'll be bulk billed. But if you're struggling to find one, that'll be a problem. I think on the plus side of this budget, the bulk billing incentive for rural general practitioners has significantly increased. So rural patients are much more likely to be bulk billed under this budget.
Okay.
And I think that's a really positive incentive. But again, on the flip side, this budget embeds fee-for-service medicine. And we've heard from Mark Butler and we've heard from the College of GPs, and it's a position I share as well, that Medicare is not suited to chronic disease. Fee-for-service is not suited to chronic disease management. So where are the fundamental structural reforms in this budget? I don't see them.
In health?
In health,
Yep.
I see embedding of fee-for-service medicine, which is slightly contradictory to what the government said it was going to do.
So what needs to happen here?
So we need to move away from fee-for-service into payments like blended payments. That's where a practice gets a fixed amount of money per annum to look after a single patient. Of course, in that sort of context, there's incentive to make sure they're on the right medications as well as they can be, so they see you less often, and the GP in the practice gets more money. And that's the sort of blended system that the National Health Service has. We need a hybrid model between fee-for-service and that, and we haven't moved that far in this direction with the current health budget.
Yeah, look, when you're looking at a reforming budget, I don't think it essentially does that. Jim Chalmers disagrees, because I put it to him this morning. And this is certainly, I think, $3.5 billion. It does speak to middle Australia, absolutely. But what I do think is quite reforming is the vaping changes.
Yes.
And what this government is trying to do. Look, critics will say it won't work. We'll just see black market vaping explode. Well, perhaps that's true, but if you make it more difficult and more expensive to get these disposable, coloured, flavoured vapes, you're going to see a reduction, aren't you? What is your overall view on what the government's announced here?
There's no doubt that the government's vaping reforms are a significant success for public health in Australia, and I do think they'll be successful. Yes, with any regulation you might get an increase in black market, but if you make it harder for a kid to get a vape, as the government will do, then the vaping rates in kids will go down.
On where we've come on this, I mean, we've been talking about this for quite some time,
we have,
vaping,
yes.
and Blind Freddie could see what was happening here. An explosion in like the last year or two.
Everywhere you look, every street you walk down on a Friday night.
And I think the previous health minister really dropped the ball on this, and they said, oh, we'll make it a prescription model, and then kind of left it. It's so disappointing to see, after 20 years, we've got the smoking rate right down, and those reforms were world leading and they worked. And then we've allowed this explosion to happen. Do you think it can get under control? I mean, do we need more research about what's actually in these things?
Well, I think we need more research to dissuade young people from taking this up. I mean, nicotine's an addictive drug, so you restrict the availability and you tell people that it's a bad thing. And if we do both those things, then we're going to cut the rates. And I do applaud the government for taking those measures. It's great.
Okay, one final one.
Yes.
I was disappointed to see not a huge emphasis on youth mental health or mental health at all in this budget. Where are we at on that? Because 2 budgets ago, we had this massive spend from Scott Morrison. It was about $2.2 billion at the time. Has that money been spent? Has it been spent well? And did this budget miss the mark on where we need to go?
Well, there's a huge youth mental health hangover from the pandemic restrictions that we had, so it is surprising that a post-pandemic budget doesn't have dedicated mental health funding. Increased general practice consultation lengths and funding will help to a degree, but not to the point that dedicated funding would.
And I'm sure you're happy to see the World Health Organisation declare the COVID emergency over. Not that it matters.
Well, I think they were about a year late, but I'm very, very, very happy to see it.
I think so too. Dr. Nick, good to see you.
Thank you.